Hello and a warm welcome from the International Students and Programs Office. Thanks so much for joining us today as we discuss student health, immunization, and insurance requirements for undergraduate students. My name is Grace Fuller, and I am from the International Students and Programs Office, where I serve as the manager of international student experience and engagement. And I'll hand it over to my colleagues to introduce themselves.
Good morning, everyone. My name is Lisa Swid, and I am one of the International Student Advisors at the International Students and Programs Office.
My name is Jill Batika, and I'm the Insurance and Billing Manager at Student Health and Wellness.
Hello, my name is Annie Horton. I'm the Nursing Supervisor from Student Health and Wellness.
Great. So as you can see, we have a number of wonderful colleagues gathered here today to hopefully answer all of your questions. But a little bit of housekeeping before we begin. So you are in listen-only mode, which means you can hear us, but unfortunately we cannot hear you. So we encourage you to submit all of the questions that you might have today through the Q&A feature on the bottom of your screen in the Zoom menu bar. If for some reason we don't get to your questions during today's webinar, you can also contact us via icontact.ucsd.edu. And then finally, we are recording. So you'll be able to review this webinar recording as well as other pre-arrival webinars we've done at iwebinars.ucsd.edu. Great, so this is just a reminder of what that Q&A feature looks like on your Zoom menu bar. And like I said, we've disabled the chat for today, so this will be the primary way that you'll submit your questions. Another quick note is that feel free to submit your questions at any point throughout today's webinar. So if there's a slide that comes up and you might have a follow-up question or you'd like further clarification, you can go ahead and submit that question. But just so you know, we will be reserving our time at the end of today's presentation to really have a live question and answer session where we'll get to all of those questions. So we may not answer that question until the end. Okay, here's a little bit of our agenda today. So we'll talk a little bit about some first steps checklist and reminders from the International Students and Programs Office. We'll go ahead and hand it over to our colleagues from Student Health Services to talk about insurance requirements as well as immunization requirements. We'll do some friendly reminders of upcoming webinars, important dates and deadlines. And then, like I mentioned, we'll dedicate the end of today's session to an open question and answer session. And with that, I'll hand it over to my colleague, Lisa, to go over some checklist reminders.
Thank you, Grace. Yeah, so just a reminder from ISPO that you are able to request your immigration documents now if you have already accepted your offer of admission. We began accepting applications on March 1st. And our advisors are busy processing I-20s and DS-2019s for students who are planning to enter the United States for this upcoming fall quarter. So please visit inewstudent.ucsd.edu for important information about how to request your documents and prepare for arrival. We do hope that you'll be able to enter the United States and begin your program of study in person. But of course, we're aware that there are difficulties in various regions around the world in securing a visa appointment at this time. So we encourage you to apply for your immigration documents as early as you can to avoid any delay. And just know that our processing time is 15 business days, so that's 3 weeks. We are not able to expedite requests unless you have an actual visa appointment scheduled. So be sure to submit a complete application to request your documents as early as possible so that hopefully you can make your visa appointment once they become available. And with that, I'll pass it over to our colleagues at Student Health.
Good day. Welcome to UCSD undergraduates. As we said, my name is Jill Batika, and I'm the Insurance and Billing Manager at the Student Health and Wellbeing Clinic here on campus. On the slide that you're looking at, on the left-hand side is a picture of our Student Health Clinic that's here on campus, centrally located on Library Walk, right down from our Geisel Library. On the right-hand side are our hardworking superstars in the insurance department that help you resolve billing issues and coordinate your care for referrals. Today, I'd like to cover what we can provide at the Student Health Clinic on campus, how to enroll in the school's health plan and how it works, how to avoid being enrolled in the campus insurance if you have other coverage, what our fee-for-service options are as a payer here in our clinic, enrollment in our RAFT offering and what that is, and how to contact us with any questions. Here at the Student Health and Wellbeing Clinic, we have a fully comprehensive primary care physician clinic. It's run by seasoned medical doctors, nurse practitioners, and registered nurses. We have a lab, an x-ray unit, an optometry suite, a dietitian that can help you with your nutritional needs, a social worker that works with our counseling and psychological services here on campus. For any mental health needs, you can come see us. We have an acupuncturist and sports medicine here in our clinic, and we're open all year round. We're here Monday through Saturday. We extend our hours until 6 on Monday and Tuesday, and on Saturday, our urgent care is available from 9 to 12. We are here during the breaks, winter, spring, and summertime, and if you'd like to make an appointment, please contact us at the phone number listed. If you do need assistance after hours, there is a registered nurse that can answer your questions or direct your care. As you register for classes, you'll notice lots of registration fees along with your tuition fees. One of the registration fees is the health fee. Every University of California registered student is automatically enrolled in what we call UC SHIP, which stands for Student Health Insurance Plan. It's a comprehensive health insurance plan that offers medical, dental, pharmacy, and vision coverage, and also offers you 60% coverage if you're traveling worldwide. We'll cover what the copays are in coinsurance under this plan, and the cost for this particular academic year will be $657 per quarter. That's charged 3 times for fall, winter, and spring, and the spring includes the summertime, so you have coverage all year round. If you wanted to look at it on an annual basis, it's $1,971 annually, and monthly it's $165 for some really great benefits. The plan is managed by Anthem Blue Cross PPO, and it offers 3 tiers of coverage, and that provides you the choices for care depending on where you want to go. Under our first tier of benefits, we're lucky enough in La Jolla to have 3 supporting UC hospitals very close to us. Right across from our campus, we have Thornton Hospital, Jacobs Medical Center, and in our downtown San Diego, we have Hillcrest Hospital. They house inpatient and outpatient services, mental health. They have cutting-edge diagnostic services, and they house over 300 specialty care providers that can assist you with anything from allergy to urology, and the insurance plan does cover those services. The first tier of benefits is the UC tier, so you could access care at any of the UC hospitals throughout the state of California at 90% coverage. You pay 10% out of pocket if you are hospitalized or if you have an outpatient service. If you just see a specialist in evaluation through the UC network of providers, it's a $10 copay and there is no deductible, meaning you don't pay anything up front to have that care. Under the second tier of benefits, it is the PPO network, meaning that any provider or facility that belongs to the Anthem Blue Cross network would be covered at 80%, but you do pay a $500 deductible, meaning you pay the first $500 of the bill and then 20% of any remaining bill thereafter. If you are seeing a doctor in evaluation and they are under the Anthem Blue Cross network and not affiliated with the UC, there is a $30 copay to see those specialists and $20 copay to see a primary care physician. The third tier of benefits is out of network, and we highly discourage that because there is a $1,000 deductible, and you'd have to pay $1,000 up front and then 40% of any remaining bills. There are plenty of providers here in La Jolla or San Diego or through the state of California that we can assist you in finding, and that will save you some money. We don't send out insurance cards, just to be ecologically minded. We do support this through an app on your either cell phone or a tablet or a mobile device. If you go to your search engine through your app store and you download Student Health, all one word, that'll download a copy of your insurance card and also allow you to view your claims as they're adjudicated. If you want to find out more benefit information or detailed benefits, depending on what your individual needs are, please visit our Office of the President, ucop.edu/UCShip or studenthealth.ucsd.edu, and we'll be able to provide any of that benefit information for you. Don't panic. If you do have other insurance, or you have insurance that covers you under a parent, an employer group, or a government coverage that's in the United States, you can waive the insurance requirement. You just have to act timely. In order to avoid paying for that insurance, you want to make sure that your insurance coverage that you have individually does cover you unlimitedly here in the United States, and that you have access to inpatient, outpatient, mental health, and also you have a primary care physician within 40 miles of our campus that you can access. If you do meet that criteria and you want to file a health fee waiver to avoid paying that insurance fee, you can do that on the Triton link and only on the Triton link. You would visit the students.ucsd.edu website. Under Triton Link Tools, under Financial Tools, you're going to click on Health Fee Waiver, and that will link you right to an application where you need to provide your insurance information and a copy of your insurance card. You have to act between May 3rd and September 10th. 2021 in order to file that waiver. If you don't act during that time frame, there is a late waiver period. We will reopen the waiver on the Triton link from September 11th until September 15th. If you don't file it by September 15th, you are stuck with our insurance and there's nothing we can do. We cannot make any exceptions because premiums to health plans are non-refundable in the United States. So you have to act during that period, and that will waive you for the entire academic year. You will have a charge each registration quarter, but there will be a payment that's assessed back to your account that offsets that initial charge. A new waiver is required every school year, so you want to file that prior to coming in for the fall. Some of our international students like to waive the insurance, and I am offering you 3 plans that you could purchase on the internet that would meet the waiver criteria. ISO Care Plan, PSI Platinum Plan, and Student Medicover, which is managed by United Healthcare, would meet our waiver criteria, and you could file a health fee waiver successfully and avoid paying those fees. If you do have care needs, you might want to take a look at the benefits and just make sure that it's going to cover you adequately, and as you need to if you do become ill or you get injured. You are always welcome to use the Student Health Clinic, either if you waive or you have the SHIP. And something to keep in mind, if you do waive, you do have to pay for the services as you go. If you do come to the Student Health Clinic, 1 primary care physician visit is $99. So I want you to keep that in mind as we talk about the raft. Other services are about 1/3 of what our community here in the United States and La Jolla would charge. So it is a reasonable amount, but you do have to pay up front. And then if you have an insurance company that can reimburse, you would file a reimbursement claim with them in order to get that money back to you. If you do have a life event, like you get married or you have a child, or if your parent loses their coverage, you can file what's called a waiver cancellation and pick up the SHIP at any time during the school year. Something to consider when you are filing that health fee waiver application on the Triton link, if you do have your own insurance, you're going to have to go out into the community and use that, because we don't accept that student health here on campus. We can't bill outside insurance companies. You are either a fee-for-service paying patient, or you're under the SHIP coverage, or you have RAFT. And RAFT is a reduced access fee membership here for the students to access the Student Health Clinic here at UCSD only. It's not an insurance. It's a $65 per quarter membership in order to come into the Student Health Clinic and not pay additionally for scheduled office appointments or in-house lab services. So if you pay $65 per quarter, you can get as many scheduled appointments here at Student Health as you'd like and have as many in-house lab services under that $65 payment. If you came in on a fee-for-service basis, you're paying $99 to see the doctor, and then you would pay for each additional lab or x-ray that you might have. So keep that in mind when you're looking at the application. RAFT, again, is not an insurance, and it doesn't replace any ongoing care or coverage that you have from an outside insurance company. It doesn't pay for prescriptions under pharmacy, or if we have to send a lab out for a specialty review. It doesn't pay for optometry or immunizations. So keep all of that information in mind when you're filling out the application. The last question on the waiver application is, would you like to pick up a RAFT? Take that into consideration, and if you do that, then if you woke up on campus and you had some sort of issue like a cold or pink eye, you could come right down to our student health clinic and have a scheduled appointment with our provider and not pay additionally for that. If you do have any questions about what we've presented today, or you've looked into our information and you have further questions, please contact us at our phone number there, 858-534-2124, or send us an email at ship3@ucsd.edu, and we'd be glad to answer you. Hopefully in the fall, we'll be able to see you here in our offices. We have been closed due to the pandemic, but we will be sitting out on Library Walk for the first 2 weeks of the school quarter, and we can answer any generic questions there. If you do have any individual or confidential questions that you'd like to address, you would make an appointment with one of our coordinators, and you can do that by calling or emailing in. And again, if you need further information on the benefits or about the SHIP program or RAFT, visit our website at studenthealth.ucsd.edu or ucop.edu/UC-SHIP. And I appreciate your time, and I look forward to any questions you might have.
Good morning, everybody. My name's Annie Horton, and I'm going to go through the incoming health requirements with you. My department oversees that for the university, and the student health nursing team is your first point of contact as you work through these requirements. Why does the university have health requirements? It's really, in 2016, the University of California mandated that all incoming students complete TB screening and prove immunity via vaccinations or blood tests as recommended by the California Department of Public Health. We want to reduce the likelihood of vaccine-preventable disease outbreaks from occurring on campus. And the nature of campus living means that it does bring us into contact with a larger number of people than our families. Having a high level of immunity in our campus community offers protection to those that might be vulnerable to disease. How do I start the health requirement process? Everything that you need to know is on the student health website. If the studenthealth.ucsd.edu, if you go to the quick links, there's a link to the health requirements for incoming students. And we have the forms, we have everything listed there. There are all sorts of resources to assist you in this process. The first step really in this process is activating your medical chart by logging into the Student Health Services Student Health Portal, which is called My Student Chart. And that is where you will find the forms also, and where you input this information. You will need your UCSD AD login, which is your email and a password, and you are issued with this after accepting a position here on campus. If you have any issues with your Active Directory login, there's an email address there that will link you to our IT support on campus that can assist you with that. What are the incoming requirements? So the first one is we want to screen to check for risk potentially of exposure to tuberculosis. So you go in and you answer a series of 5 questions, and the system determines whether you may or may not be at higher risk than average of having been exposed to tuberculosis. And if you are, the system will tell you that you are required to do testing, and there is a form that you can download and take to your provider. The immunization requirement includes Tdap, measles, mumps and rubella, varicella, which is chickenpox, and meningococcal. Meningococcal is just required for those up to the age of 22. Currently, influenza vaccine and COVID-19 vaccines are under review. It is highly likely that these will become mandates for your incoming class. We do have exemptions available, and this is for medical reasons, and the policy and the form that you would need to submit for medical exemption is also on our website. When you go to the EPIC student portal or My Student Chart, this is what you're going to see on before you log in. And I just want to draw your attention to the click to sign in with UCSD student AD login. Please use that blue button to sign up for this. If you go in a different way, it can create some issues and you may not see the requirements sitting in your chart. So if you go through this way, this is set up specifically for UCSD students. It utilizes single sign-on and it will take you exactly where you need to go. When you go into the portal, you land on a welcome page and you will see front and center student health services with incoming student health requirements. And that is for undergraduate, graduate and extension, incoming and readmitted and transferred students. So everybody is required to do these. There are links to the forms. And when you click on the incoming health requirements, you will see the following requirements there for you. And this is what you'll see: TB screening and immunization history screening. So when you click on those, it takes you into the questionnaire for TB, and for the immunization, it takes you into a series of spaces where you enter the dates of your vaccines or your blood tests, because we accept both. And likely there is going to be a third yellow box there that includes COVID-19, although we are still working on this piece. It may in fact be in the immunization history screening. And this is what you see when you go in. The system itself will provide you with a lot of information. And if you hover over those little info bubbles, it will tell you exactly what we are expecting for each vaccination. And if you have questions, I will also talk about how you reach out for those answers as well. So the tuberculosis risk screening, the undergrad deadline is July 28th. And so this is the priority really, to go and ensure that you do the initial TB risk screening. The reason I say that, because if you are required to do testing, that can take a little bit of, sometimes that can take a little bit of time. Some of you may be in countries whose health systems are impacted by COVID-19. So it's really important that you start this process early to avoid any delays in getting the testing that you may or may not need. We accept multiple different forms of TB screening, including the skin test or PPD, the blood test, which depending on where you are is called a quantiferon or a T-spot test, or a chest x-ray. For the chest x-ray, we do require that the report is included with the upload, and it needs to be translated into English, please. Once you have uploaded the documents, a student health nurse will review the submission. If anything is missing or there's any questions that we have, we will message you through the My Student Chart messages. So please return to this portal on a frequent basis and sign up for text or email alerts so you know there's a message there waiting for you to be read, and return frequently so that you can see the nurses will either tell you that you are complete if you've submitted testing, or they may ask for some additional details. So please keep checking in those message inboxes. The immunization requirements, the first thing really is to obtain your vaccine records, and there's several ways you can do that, and we will talk some more about that as we go on. There's also a form that we have put together that helps guide you and or your medical office or medical provider in exactly what the university needs. if you are missing vaccines, you will probably want to go to your healthcare provider so that they can provide you with those that are missing, and perhaps order some blood tests as well. And again, complete it as soon as you're able to. The consequence of failing to get these requirements done on time is an enrolment hold. So that would prevent you from enrolling in the full quarter if you fail to do the TB requirement. And for immunization, the hold would go on during the full quarter, preventing enrollment in the following quarter, which is the winter. So it's really important to get onto this long before the deadlines or the holds are going to be placed, because there's an enormous amount of volume that comes into us around those hold dates. And we don't want you to receive a hold if you did in fact get it in on time, but very close to the deadline. This is the immunization requirements form, and you can download this from our website or from the health portal, My Student Chart. We've linked it in both places. The first page are the required vaccines, and just a note there, I have included COVID-19 vaccine there, and it is not officially required yet. We are in a 30-day review period. And we also require that the FDA fully approves one of the US vaccines before we can mandate this. So we are still in a review period. I have added it there in anticipation. And for those of you coming from outside of the US, the likelihood is that we are going to approve those that are vaccines that the World Health Organization has approved. And currently that includes the AstraZeneca vaccine, both in Europe and the South Korean manufactured AstraZeneca, as well as the Indian version, which is called Covishield. So those ones at this point have been approved by the World Health Organization. And so that will meet our requirement if this continues to go forward in the way that we are predicting. If you are offered or have received a vaccine in your country that is not WHO approved, please go ahead. We really want you to ensure protection in the short term, and we will have available for you vaccinations here at UCSD for those that haven't had access to vaccines or those that have received vaccines that maybe the efficacy is lower than what is preferred. And last year for the incoming class, the influenza vaccine was also required, and that is still under review currently. That is another vaccine that will be available to be had on campus. We run some very large flu clinics through the fall and the beginning of winter. And so we anticipate offering that regardless of whether it's mandated. It's an extremely useful vaccine to have protection from influenza. And the same with COVID-19. If this is required, we will be providing it in large vaccine clinics on campus. These are some frequently asked questions that we get from students completing the incoming requirements, and I just wanted to include them here. Many questions we get are about how can I find my vaccine records? So in the US and in many places around the world, some of the schools that you may have previously attended may have records, your health providers, hospital, medical clinics, medical records, or early childhood records. So, and please ask your parents, they are likely to have some documents tucked away with your vaccine history on it. So that is where you can find those. Some of the vaccines may not be available in your country. For example, Tdap is not available in many other parts of the world, and so we offer it alongside other vaccines here on campus. If you have our UC ship insurance that Jill was talking about, all these vaccines are covered under that policy. If you have an allergy or a medical reason that you can't get one or more of these vaccines, then please go to our website to download a medical exemption form. And when we receive those, we will submit those to our medical director for review, and then we will communicate with you. If you can't find any of your vaccine records, one option is to go to your health provider and request a blood test for MMR, measles, mumps, rubella, and varicella. Immunity can be tested in that way for those vaccinations, but Tdap and meningococcal are not able to be tested for, so you may need to get a repeat of those. Many people in other parts of the world have had what's called a BCG vaccination as a child to protect against tuberculosis. And even if you've had this vaccine, you do need to get TB testing. It does not offer lifelong protection from tuberculosis. And our preference, if you have had BCG vaccine, and the way you can tell is on one of your arms, you may have a little indentation in the skin. That's usually from a BCG vaccination. We do recommend, if you can access it, to get a TB blood test, as it's more accurate if you've had the BCG vaccination. If you have a positive TB test, either skin or blood test, then your healthcare provider needs to order a chest X-ray just to make certain that the test is not showing us that you have current active tuberculosis disease. If your medical records are not in English, please have them translated. And there are a lot of questions currently coming in about special considerations if you have received or are receiving the COVID-19 vaccine. And the US Centre for Disease Control and Prevention recommends that you have a 2-week gap between regular vaccines and the COVID-19 vaccine, and also to wait for 4 weeks if you get TB skin testing or blood testing, because the vaccines can interfere with tuberculosis testing. So please be aware of that. And I've highlighted it on our forms so that it reminds you and your provider to consider the timing of your vaccines and TB testing. Where can you get help if you need it? The best way of getting help is going through your My Student Chart health portal, clicking on messages and going to Ask a Nurse. Those messages then come to a large team of us that can respond to those. We have nurses responding to those questions almost 7 days a week. That is the absolute best way of doing it. Calling our clinic isn't going to, there's an enormous volume of calls that come in around this time, and usually we're recommending that people send a message. We do have an email address that you can utilize, but that's only if you're having technical difficulties. Please do not include any health information in that email. Email is not a secure way of sending private health information. So for any technical issues, please feel free to reach out on this email. That goes to our medical records department that are really skilled in helping with some of these IT issues. Everything else should go through Ask a Nurse, please. You can refer to our website, as I've mentioned. It has a wealth of information there, as well as some recorded webinars that we've offered, we've done with students that reiterates a lot of the information in this. And I just, please complete your requirements as soon as you can. If you are in a country and you are having significant difficulty accessing routine healthcare, please send a message through Ask a Nurse and I can discuss that with you. And just, we are here to help you. These are actual pictures of our clinic and some of our nursing team. So please feel free to reach out to us with any aspect of this process. We are absolutely here to help you be successful in achieving this compliance, to offer you protection and our whole campus community. So thank you so much for listening.
Great. Thank you so much, both Jill and Annie. Before we transition to our question and answer session, I just want to highlight a few opportunities where you can already start to get involved in the UC San Diego Triton community. So one is our Global Ambassador Program, commonly referred to as GAP. And GAP is a peer mentoring program designed to assist incoming undergraduate, international, and out-of-state students in acclimating to a new environment and making a smooth transition into university life. So GAP mentors are current undergraduate students at UC San Diego, and they provide friendly support over the summer in order to engage our undergraduate non-resident students, as well as help them create solid relationships within the UC San Diego campus. So I'll go ahead and put that link, that sign up link in the chat, and you would get matched with a GAP mentor. So again, a current undergraduate student at UC San Diego. And oftentimes the form will ask you kind of how you prefer to be matched. So do you be preferred to be matched with someone in your same college, within your same major, maybe from your same home country? And then you can chat back and forth all summer to get as many questions as answered as possible. So we really encourage our incoming students to take advantage of the GAP program. They often find it very useful. The next program I want to highlight is our International Peer Coaching Program. So GAP is over the summer as students kind of transition, but the International Peer Coaching actually goes throughout your entire first year at UC San Diego. So the International Peer Coaching Program is specifically for international students as they transition to UC San Diego, and they do so by establishing meaningful connections and developing personal and professional relationships with fellow UC San Diego international students. If you'd like to learn more about the International Peer Coaching Program, I encourage you to check it out at ipeercoaching.ucsd.edu. And again, I'll go ahead and put the sign-up link to join the International Peer Coaching cohort for the 2021-2022 academic year in the chat in just a moment. This is actually a picture of our international peer coaching team for this current academic year. So you can see we have a lot of smiling faces who are excited to welcome you to UC San Diego. And something that they're doing right now is hosting regional meetups for international students and specifically for incoming international students. So if you would like to meet students possibly from your same home region that's attending UC San Diego, or you just kind of want to start meeting people and building your Triton community, then we encourage you to attend some of our regional meetups. And you can learn more about the regions, the dates, and the times at ievents.ucsd.edu. And that's where you'll find more information about these regional meetups. And then finally, actually, this is the QR code. So feel free if you want to go ahead and take out your phone to scan this QR code on the screen. We also have this bit.ly URL. So just bit.ly/IPCPP2122. And that is the way that you'll join the International Peer Coaching cohort for the 2021-2022 academic year. We are so excited to welcome you to UC San Diego. Okay, so we have made it through a good amount of webinars, but we still do have some upcoming ones left. So tomorrow on May 6th at 11 a.m. Pacific time, we will focus on SEVIS transfers. So if you are currently in the US, maybe at a US high school or another US university, and you need to transfer your SEVIS record, we encourage you to attend this webinar tomorrow. On May 11th, we will focus on campus safety. On May 18th, focus on student life and getting involved. And finally, on May 20th, we'll have student accounts and finances. So iwebinars.ucsd.edu is kind of your one-stop shop to both view previous webinar recordings, as well as sign up for future webinars. Here are some important deadlines and reminders. So like Lisa mentioned, you can begin requesting your visa documents now via the iPortal. So just head to iportal.ucsd.edu. May 1st was the deadline to accept your admission. So congratulations, because if you're here, you probably have accepted your admission to UC San Diego. So huge congratulations on that awesome accomplishment. Like I said, we'll have campus safety join us on May 11th. July 1st is your transcript postmark deadline. And then in September, we're very excited to welcome our new cohort of students through our new international student orientation. A new feature we really want to highlight for our students is our Ask Triton chatbot feature. So if you go to our website, so you could go to ispo.ucsd.edu, and on any of our pages, you'll see this chatbot. And so this is a great way to get, some of your first initial questions answered. Our website has so much good information, but we also understand that it can be overwhelming at times because it is so full of information. And so the chatbot really helps you kind of navigate the website and take you to the page that's directly applicable to you. So we encourage you that if you have any questions, starting with the Ask Triton chatbot feature is a great way to start getting those questions answered. All right, so now we will open up for our question and answer session. But yes, before we begin, just want to encourage you to, if we don't have any questions answered, some of your questions answered today, you can always reach out to us via inewstudent@ucsd.edu. And we'd also love to connect with you on Instagram. We actually made this Instagram AR filter congratulating all the new students who will be joining our Triton community. So you can feel free, follow us at ispo.ucsd, try on our Instagram filter. And if you share it and tag us, we'll make sure to reshare to celebrate our new students. Okay, so I can see that we already have some really good questions in the chat that I'll go ahead and open it up to. So our first question is for Annie, and the question reads, in India, COVID vaccinations for folks under 18 have not been made available. So what would be the right way to deal with this situation?
Yes, that's very common actually in lots of parts of the world. It's not yet open. However, we will make available COVID-19 vaccine for all incoming students.
Wonderful. Thanks so much, Annie. So our next question reads, if I got the Sinovac vaccine, do I need to be vaccinated again when I get to campus?
It is possible that you may need to. At the moment, Sinovac has not been approved by the World Health Organization. That could change. So we will absolutely let you know if some of the vaccines that people have received outside of the US are going to provide you adequate coverage. And that's really what it's about. We really want you to have as much protection as possible. So it may be possible. We do have single dose vaccines approved here in the United States, so that may be an option. But we will help you, and we will be posting a lot of information going forward as the situation evolves and gets approved and develops.
Great. Our next question reads, how early do I have to arrive in California to get both vaccines in the United States before the start of the academic fall quarter?
It really would depend on which vaccination that you received. However, my anticipation is that as long as you are in the process of receiving COVID-19 vaccines, it's not probably going to be required to come onto campus, but it will be likely a requirement going forward. So we will provide you time to obtain those vaccines during the early part of that full quarter.
Wonderful. All right, and our next question is, if I already got the vaccine, what is an appropriate document or documents to prove so?
For all vaccines, especially COVID-19 vaccine, actually, I'm not sure if it's in reference to that, Grace, or not, but I'm presuming so. Whatever documentation was provided to you at the time of receiving it, or some other official form of acknowledgement that you received the vaccine. In the US, we have CDC cards, and I know that there is different forms of documentation because I've received some already from India and China. So just whatever your local area is providing you as proof is absolutely fine.
And Jill, I know that you have been answering some questions via the Q&A, and so I'm wondering if there's any common questions that you're seeing or different points you'd like to reiterate to remind students.
I think the question that is common is if they've received Covishield, and do they need to get vaccinated again in America? And I think what Annie said is that is recognized by the World Health Organization, so that should be acceptable. And correct me if I'm wrong there, Annie.
Sinovac is not accepted at this time. It's not approved by the WHO, but it still provides protection. So I'm not discouraging anyone from receiving it if that is the vaccine that you have in your country.
I think that was it.
I see that there is a question in the chat, maybe in regards to the links I was mentioning. So I'll take a moment to drop those into the chat right now. And I'm also seeing a question about accessing the recording of this webinar. So all of our webinars the recordings are posted at iwebinars.ucsd.edu. And if you click on the tab for newly admitted students, so webinars for newly admitted students, and then go to pre-arrival webinars, that's where you'll see that. We usually have a 2-week turnaround in terms of when the webinar was aired live versus when it's posted on our website. So you might expect a little bit of time between those two dates, but you can also go ahead and reference a lot of the other webinars that we have covered. So that's where you'll get some good information as well. And then Annie and Jill, and no pressure, but as I'm putting some of those links in the chat, depending on the questions that you see, are there any other reminders that you'd like to leave students with when it comes to some of the common questions we're seeing come through the Q&A?
This is Jill. I just want to reiterate that you have this insurance that's amazing, that when you come to campus, you can use it right away. The first day that it'll be effective will be September 20th. So if you do need any care needs, or unfortunately you fall down when you get to campus, come on over to the Student Health and Wellbeing Clinic right on campus, and we'll be glad to service you. If you do have any questions, please let us know through ship3@ucsd.edu. And I'll leave it to Annie to answer your COVID questions and your immunization questions. Thank you.
Thank you, Jill. I just want to encourage you all to start the TB and immunisation as soon as you're able to. Go to our website. The link to my student chart is on there. It does require that we've already loaded you into our system from the campus. So sometimes there's a little bit of delay in that, but we are loading, as new students accept their positions in campus, we're loading every single week. So if there's any delay, just trust that you will be loaded in as soon as we can get that information in. You need your UCSD email and AD login, and reach out to Ask a Nurse if you have any questions. Thank you so much.
Annie, I'm seeing a question in the chat that says, if I wanted to receive the second dose of the Pfizer vaccine, do I need to arrive 21 days early or earlier?
No, there's no requirement for that at the moment. The only thing I would say that there may be other requirements that campus have in place for those that are in the process of getting vaccination. We don't consider people fully immune until 2 weeks following the final dose, whether that's a single dose or a 2-dose vaccine. So you may be required to COVID test. We have COVID testing on campus, but just watch campus communications regarding all of those types of details. They're still all being formulated. The situation is changing on a daily and weekly basis, and so we're just planning everything for you to keep everybody as safe as we possibly can.
And Jill, I'm seeing another question come through the chat, and it's a question about maybe doing a reminder about what is the insurance fee and where do students submit it?
Certainly. So on your registration fees, when you register for classes, you'll have your tuition fee, and then you'll have probably about 8 or 9 registration fees for attending the campus. and one of those is the health fee. So every student is automatically enrolled in the insurance plan through the school unless you opt out of it. And you can opt out of it by having your own insurance, and you apply for a health fee waiver through the Triton link between May 3rd and September 10th, or through our late waiver period, which is a $50 late fee attached to it, but it will reopen between September 11th and September 15th if you need to file a waiver to avoid paying that health fee. For this upcoming academic year, it's $657 per quarter. And that will be for fall, winter, and spring. Fall and winter are about 10 to 12 weeks in duration. And then the spring quarter includes the summer, so it's just about 6 months worth of coverage.
All right, that looks like most of our questions for today. I'll leave another minute or two if you have any maybe last minute burning questions and you're typing right now. I want to make sure that I'll leave a minute or two for you to submit those. But yes, like I said, this webinar will be available. Jill and Annie have graciously provided a lot of good contact information. So if you want to ask more questions, you can definitely do so by utilizing that contact information. And there's a lot of really great information, resources, as well as videos on the Student Health Services website. So that's a great resource to head there in case you have any additional questions that come up, maybe that arise after. Oh, wonderful. And Jill just put the link to that in the chat. So studenthealth.ucsd.edu is a great way for you to access a lot of those resources. Okay, so it looks like that is our questions for today. We hope that you found this webinar useful and that you're feeling supported as you begin your journey at UC San Diego. And with that, we hope you have a great rest of your day. Thank you.